I chose to study a Master in Health Policy at the City University of London because of the reputation of the university. I did my research online about the universities that are in the UK and in London, especially in terms of Master in Health Policy, and I found out that City University is among the best. Also, I was encouraged by the experiences of different alumni who spoke about their jobs now in the arena of health policy, and I found out that many of the graduates of City University are doing high profile jobs at think tanks, civil service jobs. So this has pushed me to think about applying to study at City University of London. What I like the most about health policy is the idea of debates, the idea of having many options to reform healthcare system, the idea of having many parties having competitions in order to improve the delivery of healthcare system, everyone providing arguments in favor of certain policies in order to improve the health of the nation, and I found that fascinating, especially in the context of Britain. And we know that the NHS is always open for discussions and debate on how to reform it and so on. And I became interested in the subject from my country, Tunisia, because I was working in a hospital and I was as a pharmacist, and I was seeing how things are going on there. And I found that things needs to change and reforms are needed. So I started to think about doing a master in health policy in order to understand how to make effective changes in the system, and hopefully that I can make that contribution when I go back to Tunisia. Before applying for the master in health policy, I was working in Tunisia as a hospital pharmacist, and applying for a new master in a different country was quite exciting for me, since it was the first time going abroad to study. Going back from working to study was quite a challenge for me, because I was used to the career of pharmacist, and then I had to turn to a new career, to new master, and therefore I had to rewire my mind in order to be back to the mindset of a student. Having different students from different parts of the world is something that never happened to me before. And I was very, very happy and lucky to find international students here in London. Being an international student in London is a very exciting experience, because you will be able to meet students from all over the world, and you'll be able to know about their culture, their customs, and about their country. And I was quite lucky to enrich myself in this subject. Of course, this is very different from my country, because we didn't have that much diversity, and I was very, very happy to be here and learn about different people from different countries. Also, studying in London is quite an easy experience, because at university they will provide you with support needed in order to navigate London. You will have the academic support, mental health support. If you'd like to practice your faith, you will be able to do so. If you'd like to participate in societies at university, you will be able to do so. So basically the life in London is rich, and you won't get bored, trust me. You will find all what you need in order to thrive in London, and it's a very, very nice experience. My favorite moment at City University of London is when we get back to study face-to-face instead of online learning. It was an opportunity for me to meet my fellow students, to interact with my professors. And it's very important to do so, because it's very important to build your network, to establish new connections, and it will help you in your career and in your social life. And I was very, very happy to do so, and hopefully that after 2 years of the pandemic, we will carry on studying face-to-face. My favorite module for the Master in Health Policy is the International Health Systems, because you'll be able to compare the provision and the outcomes of different healthcare systems around the world, and ways to improve each system. And I found that very, very interesting to be able to see how different countries operate, and how different countries have different outcomes depending on the provision of their healthcare system. And hopefully you will find it enjoyable too. Outside my course, I was volunteering with a sexual health charity in London that's helping BME communities navigate the healthcare system. I would urge everyone to choose one charity and dedicate some free time to it. There are plenty of fantastic charities in London that are doing amazing job and helping vulnerable people. So yeah, take some free time and help them. This experience allowed me to grow both personally and professionally. Personally, because I have met people from different cultures and countries, and this is very enriching for me. And I'm grateful for that experience. Professionally, because I was able to master the two important skills in health policy, which are writing skills and analytical skills. I'm happy about my experience, and hopefully that you will have the same experience.